Chapter 30, Personality Disorders. What is personality? Personality is a composite of behavioral traits and attitudes that identify one as an individual. This is the unique pattern of thoughts, attitudes, values, and behaviors that each human develops to adapt to a particular environment and its standards. As we grow older, that's when we actually adapt, right? Through thoughts, attitudes, experience, values, and the behaviors of those people that surround us, and all of those experiences that we experiences all throughout our life. That is how a human actually develops the personality. Studies of those families and twins and relatives with personality disorders have demonstrated that the developing personality is influenced by genetics. So, the personality actually can be influenced by genetics based on research or also by the environment, okay, that we're actually trying to adapt to as we grow older. Highly functioning people move freely along the continuum of the social response, either maladaptive or adaptive response, recognizing and balancing their needs for intimacy with their needs for solitude. Those that have those personality problems, they struggle to define and meet their social needs. Let's talk about personality throughout the life cycle. Starts in childhood, right? Trust versus mistrust, like we said. When the infant's needs for food, comfort, safety, and socialization are consistently met, a sense of trust and self worth develops. So, meaning from the moment that we're actually a baby, right? That's when we're actually starting to develop personality. So if a baby actually keeps um, having having her needs being met, then that infant is actually going to learn to trust others. Whereas an infant that is actually in an environment where the needs is not constantly met, then there might be a chance that that infant is going to grow old and is going to have those trust issues. Okay. All right. Toddlers develop object constancy. This is the part where the toddler actually will understand that a loved one, a person, or even an object, even though they don't see it or is out of sight, continues to exist, right? And this is around toddlers. Morality begins to develop between 6 and 10 years of age. And we did mention this in the previous chapters where a 10-year-old is actually going to understand that death is permanent. Personality in adolescence. So, personality around this time is now established, right? However, what we're trying to do around this time, adolescents trying to do is they're trying to assert their independence from their parents. And this is why a lot of adolescents are actually having that um, conflicting relationship with their parents is because of this reason that they're still trying to develop or establish those personality well. However, they're actually trying to assert their independence. So there's like a conflicting idea. Do I actually exercise my independence, or do I actually listen to my guardians, right, or parents? Adolescents support each other in their struggles to assert themselves and cope with the stresses of becoming adults. So just think about it, okay? Is your personality today the same as it was when you were a teen, right? Um, yes, the personality is well established. However, when you grow into the adulthood, there's still going to be some life changes that happens, and that actually kind of like changes your personality as well. Experiences, right? The loss of maybe a loved one or a friend or someone or anything actually helps you develop or put your personality in a more established state. Teens, they are categorized by their peer groups, right? Some would call them, oh, you're a nerd, right? You're a tough guy, or you're a cool teen, right? But again, bottom line is their personality is well established. However, they are still trying to explore that environment and try to actually go through that transition from being an adolescent to an adulthood. By personality in adulthood, by young adulthood, most individuals are self sufficient, involved in give and take relationships, making occupational choices, starting the families, grow in self awareness, and sensitive to and accepting of the feelings of others. And these are things that you know that an adolescent might probably have, right? But it's not going to be as strong as when you get into adulthood yet. All right. By middle adulthood, most individuals are comfortable enough with themselves and their relationships to encourage independence in others, growing and evolving relationship with friends and significant others, right? We're working on growing and evolving the relationship, either with our friends or with the partners or with our family, experiencing changes in demands on their time. Like I was talking about earlier on, like maybe a loss of a friend or that moved, you know, far away, or someone that you used to actually talk to, now you don't talk to them anymore, right? Or maybe a loss of a job, right, that you really really wanted. Those experiences actually changes the personality of an adulthood. Personality in older adulthood, older adults must cope with loss and change, right? That's the biggest thing that they actually usually have to cope with. Strength of personality carries them through life's rougher times, and do not assume that a personality change in an older adult is normal. What does it mean? It means that if you are taking care of a patient and you know their norm with their personality, then all of a sudden you see that there's a change in that personality. This is not normal, okay? So as a nurse that's taking care of the patient, we have to do something. We have to make sure that we are actually evaluating the situation further, right? So one example that I can think of is maybe you're a nurse that's taking care of an older adult, and that older adult used to be independent, right? Used to drive their car, go to work every morning, buy their own groceries, go to the bathroom by themselves, um, just like the like a normal ADLs that you do in independently every day. And then all of a sudden, now this patient is a dialysis patient, right? That actually goes to dialysis 3 to 5 times a week. And they're actually spending those times in treatment. And then in addition to that, after the treatment, they go back to the facility where you're working at and they're very weak. They feel very tired, right? So think of that transition from being an independent to someone that is actually weak or someone that actually needs help with almost everything. That actually plays an important role um, with the change of the personality of a patient, right? Of a person. So that person probably used to be happy, used to be bubbly, and now because of the situation that's going on in their life, you're gonna have a patient that's actually always mad, always sad, or non-compliant with everything. Okay, so those um, situation in a person's life actually can play a role with the personality change of a patient or a person. We have theories related to personality disorder. You have your biological theories that believes that one's temperament, like your energy levels or the moods and attitudes, is by genes. Okay. Abnormalities in certain neurotransmitters, such as your dopamine and serotonin, are linked to maladaptive behaviors. All right. The brain mechanism that connects emotions with intellect may be missing or inefficient in individuals with a personality disorders. Psychoanalytical theorists believes that infants begin to discover the nature of good and bad and love and hate as the superego grows. So it has something to do with the id, ego, and superego, right? The three personality components. If the mother responds in ways that cause frustration, distress, or pain, the child will have difficulty finding the proper fit between aggression and love. Behavioral theories are theories that believe that personality disorders are the result of conditioned responses caused by previous events and the result of unmet needs during those critical developmental periods. Sociocultural theories, they believe that the cause of the personality disorders are embedded in culture and society. And the foundation for personality disorders is built on society's social and cultural stresses. So, sociocultural theories also believe that gender and the cultures they play an important role for these personality disorders. Like, for example, women are more likely to suffer from depression than men, and schizophrenia occurs more frequently in lower socioeconomic classes. Now, let's talk about personality disorders. These are long standing maladaptive patterns of behaving and relating. All personality disorders are characterized by some continual difficulties with interpersonal relations. Interpersonal meaning that it's like between one person to another person. Okay. Some patients have maladaptive behaviors but are not given the diagnosis of mental illness. And you will see this out there all the time, right? You will see a lot of maladaptive behaviors and yet they don't have the diagnosis for the mental illness. All right, the most important criterion for a personality disorder is that behaviors are inflexible and maladaptive and cause significant functional impairment or subjective distress. These are Diagnostic and Statistical Manual of Mental Disorder. We have classified some personality disorders. They are grouped into three clusters: eccentric, erratic, and fearful. Eccentric cluster, we call it cluster, is characterized by odd or strange behaviors. The individuals in this cluster, eccentric, find it difficult to be comfortable in social settings and do not relate well to others. Okay, there you go. Eccentric cluster, characterized by odd or strange behaviors. And individuals with problems in this cluster find it difficult to relate to others or to socialize comfortably. Diagnoses in this cluster include the paranoid, schizoid, and schizotypal. Paranoid personality disorder are diagnosed in up to 2.5% of the population, more often in men than in women. This is when there's a some kind of paranoia. Paranoia is a suspicious system of thinking that includes delusions of persecution and grandeur. So they these patients actually believe or they assume that everyone is out to get them. Everyone is out to harm, to deceive, or exploit them. And because of that reason, these individuals they avoid becoming close to other people, right? They don't have friends because they avoid sharing that relationship or becoming close to somebody else because they believe that if they become close to other person, that person can actually be use all the information they know about them to be against them. All right. With that being said, we need to remember what we call ideas of reference. Ideas of reference are incorrect perceptions of casual events as having great or significant meaning and are frequently seen in patients with these personality disorders. Okay, schizoid and schizotypal personality disorder, they are marked by an inability to develop and maintain relationships with other people. Schizoid personality disorder, they lack the desire or willingness to become involved in close relationships. This is what we call loners, right? They prefer to be alone, they prefer solitary activities and just their own company. Then you have the schizotypal personality disorder. This is when there's a pattern of avoiding people, as in like the schizoid, but behaviors here are characterized by distortion and eccentricities, like your odd, strange, or peculiar actions. The ideas of reference that we talked about earlier on, this is very, very common with the schizotypal personality disorders. These people with schizotypal are often superstitious or believe in the paranormal. They even believe that some people actually have those special powers, those magic that can read people's mind. So, or kind of like, or maybe control the mind of others. So, some patients that have schizotypal, they actually think about that. Then we have the next one, which is the erratic cluster. Erratic cluster are the defining characteristic for this group of disorders is dramatic behavior. These cluster consists of four separate disorders: antisocial, borderline, histrionic, and narcissistic. The first one is antisocial personality disorder. This is often referred to as psychopath or sociopath. Okay, they have no conscience, they have a lack of conscience, and they also have very poor impulse self-control. Like those serial killers like Ted Bundy, they could actually be diagnosed under this antisocial personality disorders. because of the lack of conscience, and then the lack of self-control. Then we have the borderline personality disorder. This is when the person has a pattern of instability in mood, thinking, self image, behavior, and even personal relationships. There is an intense fear of being abandoned, or so that's why this patient actually avoid being alone. However, because of their personality instability or their mood instability, they love to actually have those extreme shifts, right? So they are actually, even though they don't want to be alone, there are those people that actually wants to shift. They're not going to stick onto just one commitment, one person. Okay, so there's a sudden dramatic changes in career plans, types of friends, values, and even sexual identities with these individuals. Impulsivity is one behavior that is actually very common with borderline personality disorder. Impulsivity is acting without thinking, or acting without actually thinking what is going to be the consequence. Okay, this is one feature of borderline personality disorder. So that's why this people actually have those impulsivity, like they gamble, they abuse drugs, they practice unsafe sex with multiple partners, and they actually do like self-mutilating behaviors. Okay, now histrionic and narcissistic, the common denominator between these two personality disorders is that they are attention seeking behaviors. Okay, attention seeking behaviors. Histrionic is a type of personality disorder that displays a pattern of excessive emotional expression accompanied by attention seeking behaviors. These people may be flashy or dramatic in their how they actually show themselves, like how they dress up, their mannerisms, how they talk. They are emotionally shallow and often live in a romantic fantasy world. Then narcissistic personality disorder is characterized by a pattern of grandiosity and the need to be admired. So these are those individuals that actually believe they are the best. They are special, right? They are unique. They are VIPs, okay, at all times. They actually love being admired, getting all those attentions from others, okay? And what happens is that because they love being the star all the time, when they become when others actually outshine them, they become very, very angry because of that. All right, so histrionic, narcissistic, that these two actually are attention seeking behaviors. Then we have the next cluster, which is a fearful cluster. This is the most common characteristic. I'm sorry, the common characteristic of the fearful cluster is anxiety. The three personality disorders in this cluster are avoidant, dependent, and obsessive compulsive. In the avoidant personality disorder, the anxiety is related to a fear of rejection and humiliation. So to prevent possible rejection, these individuals, they actually narrow their interests to a small range of activities, and it is a part of the fearful cluster of the disorder itself. They are hypersensitive to criticism and often feel inadequate and inferior. They are very, very shy in social situations. So they are also scared of um, reactions or interactions to others. So if you put this people with this personality disorder, they will actually have an anxiety attack if you put them in a spot where there's like a lot of interactions with a lot of people. Okay. Avoidant personality disorder. Now, dependent personality disorder is associated with separation and abandonment. They have a very um, deep fear of rejection. So what they do is they become very submissive, right? They become submissive towards those people that they don't really want to lose. So that's why it's called dependent. Now, with the obsessive compulsive personality disorder, these are those people that actually have those anxiety if um, there's like a task that they don't actually see as perfect as they want it to be. So these people for with obsessive compulsive, they want to do it themselves. They want to do tasks themselves, right? They don't want delegating other to others because they're like they want the desire to be in control of everything, and no one else can do it better than they do. So that is obsessive compulsive. Each disorder is related to certain expressions of anxiety. Again, for the fearful cluster, it has something to do with if they don't, if these things don't happen, then they are going to have an anxiety. Dual diagnosis is when there is a personality disorders that also suffer from substance abuse or other mental health problems. Therapeutic interventions, so the treatment decisions are guided by the patient's presenting symptoms, complaints, and problems. So what can we do for these patients? We can do psychodynamic therapy, cognitive therapy, behavior therapy, group therapy, family therapy, or we can actually also give them some medications, right? Antipsychotics is one, it's very big for this personality disorder. However, please don't forget that when we're giving antipsychotics, we are actually monitoring for signs and symptoms of the side effects, right, of antipsychotics, which is your EPS. So please do not forget when we are giving antipsychotics, there is a risk for EPS, extrapyramidal symptoms, and we are monitoring patients for that. Now, the cure is not the goal of therapy. The goal for this personality disorder is for those people or for the person to become aware of their actions and how it affects their lives. When we do this treatment with the patient, we have to provide limit settings, and we have to be very consistent with how we're doing our therapy with them. Nurses must exercise great care when administering medications to individuals with personality disorder. I was just talking about those EPS when we're giving antipsychotic is one example. Antidepressant too. When we're giving antidepressant, one side effect that we're monitoring is that they actually have an increased risk for suicidal thoughts and plans. Okay, so this patient that we're treating, especially those outpatient in an outpatient basis, we want to make sure that the amount of the prescribed medication must never be large enough to allow a successful suicide. And when we're doing that, we are also monitoring them for any suicidal thoughts and plans. We directly ask the patient, do you have any, suicidal thoughts or suicidal ideations, and how do you plan on doing it if they do, right? Again, the goals of care for patients with personality disorders is to help them identify their behaviors and then become responsible for those behaviors, to assess the clients in developing satisfactory interpersonal relationships, that it's not affecting with their relationship with other people, right? Interventions and evaluations are developed for each diagnosis and are specific to the individual client. All right, question one, which is not one of the four general theories of personality? Answer is four, experiential. Question two, the nurse is caring for a client who has a history of paranoid and schizoid characteristics in her personality. She's detached from social relationships and exhibits odd behavior, thinking, and speech. This is known as what type of cluster disorder? Answers 1, eccentric, odd behavior and thinking and speech. Question 3, Samantha is caring for a patient with a history of feelings of inadequacy and oversensitivity at times. Her client is avoidant. What type of cluster disorder does the client have? Answers 3, fearful. Question 4, the client is taking Tegretol. Common side effects of this medication include slurred speech, confusion, and bone marrow depression. What type of drug is this medication? Tegretol is an anticonvulsant. Question 5. The nurse is caring for a client with a personality disorder, which is an appropriate goal. Answer is 3. Assist the patient in developing satisfactory interpersonal relationship.